Covering Unit Number 1, Chapter Number 2. Health, Illness, and Stress. 1. Health is defined as healthy lifestyle, free of diseases, values, experiences, and ways of living, standard living of life. 2. Which statement best describes health? Health is a relative state of being, the total state of physical and psychological well-being, the state of functioning well physically, mentally, and socially, being free of sickness or infirmity. 3. The nurse must understand that certain cultural traits should be assessed in patients. Patients of Asian, African, and Hispanic descent should be assessed for stomach cancer, retinopathy, sickle cell anemia, lactose intolerance. 4. It is important to assess a patient's actual cultural beliefs because a patient may not adhere to the usual health beliefs of their culture. Cultural beliefs play a major role in how the patient perceives self. The family's beliefs are inherent in the patient. Cultural diversity is present in all parts of the United States. 5. When setting priorities of patient needs according to Maslow's hierarchy, you should select all that apply. Only consider physiologic needs. Consider airway status first. Consider safety as high priority. Place self-esteem needs before security needs. Place activity needs before belonging needs. Consider elimination needs before rest and comfort needs. 6. A patient had major surgery and says they are worried about what is happening at home, is worried about not being there to coach the soccer team tomorrow, is feeling pain, and wants to see their significant other. Which action would you take first? Tell them not to worry about things at home. Allow them to call the children at home. Administer pain medication. Check to see who might be able to coach the soccer team. Put in a call to patient's significant other so that the person can obtain information and arrange for someone to coach the soccer team. 7. Which is the best description of homeostasis? The body tends to adjust constantly to changing conditions. It occurs when the equilibrium of the body is disturbed. It is the biologic reaction that takes place in response to a stressor. It is a static condition of the body during health. 8. The effects of stress on a person partially depend on A. The presence of prior illness. B. The time of day it occurs. C. The surrounding environment. D. The perception of the stressor. 9. Common sympathetic reactions to a stressor that occurs suddenly include select all that apply. A. Constriction of the pupils in the eyes. B. Increase in saliva and tear production. C. A weak in the knees feeling. D. Pounding of the heart with rapid pulse. E. Dilation of the pupils. F. Increased blood pressure. 10. Illness occurs in stages. What are 3 stages of illness? A. Basic, middle, end. B. Transition, acceptance, convalescence. C. Admission, transfer, discharge. D. Fever, CHD, transition. 11 nurses take a holistic approach to caring for the sick and promoting wellness. What is a holistic approach? A person's biologic, psychologica, sociologica, and spiritual aspects and needs. A person's basic rights and medical requirements. A person's right to appeal for medical grants. A person's interests to be health. 12. Abraham Maslow introduced a theory of basic needs. What are the steps of Maslow's hierarchy? Physiologic, self-esteem, love, and belonging. Self-actualization, self-esteem, love and belonging, safety and security, physiologic. Independence, motivation, learning, nutrition, elimination. Hygiene, activity, sexual procreation, talent. 13. What is illness? Physical unfit. Unhealthy lifestyle. Sick but looks healthy. Disease of body or mind. 14. The law that defines and regulates the practice of nursing in the United States. New Public Act. Nursing Practice Act. Nursing Public Act. Nursing Private Act. 15. Profession that focuses on the holistic person receiving healthcare services and provides a unique contribution to the prevention of illness and maintenance of health. PCP. Surgeon. Nursing. Sanitization. 16. The knowledge base for care that is provided is called medical, insurance, chemistry, science of nursing. 17. Which skilled application of the knowledge to help people reach maximum quality of life and health, i.e., someone can never be healthy due to a terminal illness, but a nurse can help them maximize quality of life. Choose one that applies. Nurse. Nursing. Art of nursing. Art. 18. What 5 systematic problem-solving methods of nursing process are? Assessment, diagnosis, planning, implementation, and evaluation. Apply, transfer, treat, diagnose, and health. Assessment, knowledge, test, teach, and transfer. Medicines, vitals, pulse, respiration, and blood pressure. 19. Systematic problem-solving method by which nurses individualize care for each patient is called medical process, healthy process, biological process, nursing process. 20. A patient has been experiencing persistent fatigue and a mild fever for several days, but dismisses these symptoms as unimportant and avoids seeking medical attention. This patient is in the underscore stage of illness. Convalescence. Transition. Acceptance. 21. A nurse is prioritizing care for multiple patients. According to Maslow's hierarchy of needs, which patient should the nurse see first? A patient who is feeling anxious about an upcoming surgery. A patient who is feeling lonely and isolated after being hospitalized for several weeks. A patient who reports shortness of breath and seeing spots. A patient who is requesting to speak with a chaplain about spiritual concerns. 22. Which of the following is a key component of emotional wellness that nursing professionals should develop to handle work-related stress effectively? Avoiding all stressful situations. Only focusing on physical health. Developing resilience and emotional regulation skills. Ignoring feelings of stress. 23. Which of the following factors is most likely to contribute to chronic stress? Select all that apply. Consistent sleep schedule and frequent rest. Poor time management and heavy workload. No social support system and limited family. Feelings of not being good enough. Regular physical activity and water intake. 24. Match each description with the correct component of holistic health. An individual engages in regular exercise, eats a balanced diet, and gets adequate sleep to support overall well-being. Spiritual health. A person practices mindfulness and stress management techniques to maintain mental clarity and emotional stability. Physical health. A person finds purpose in life, connects with others in meaningful ways, and engages in activities that align with their values. Mental/emotional health. 25. A patient recently diagnosed with diabetes states, "There must be a mistake. I feel completely fine, and I don't need to change my diet or take medication." The nurse recognizes this as which defense mechanism? Rationalization. Repression. Denial. Projection. 26. Which of the following physiological responses is commonly associated with the body's stress response? Increased heart rate. Decreased respirations. Relaxed muscles. Decreased blood pressure. 27. What is the term used to describe the body's natural response to a perceived threat or challenge, often referred to as the fight or flight response. Homeostasis. General adaptation syndrome, GAS. Stress adaptation. Relaxation response. 28. The nurse is aware that any description of health would include the concept that illness is a biological malfunction and health is biological soundness. Culture, education, and socioeconomic status influence one's definition of health or illness. The concept of health is influenced by culture, education, and socioeconomic factors. Health is the absence of illness, and illness is the presence of chronic disease. Lifestyle factors are the major determinants of health or illness. 29. The nurse takes into consideration that the patient with an admitting diagnosis of type 2 diabetes mellitus and influenza is described as having 2 chronic illnesses, 1 acute and 1 infectious illness, 2 acute illnesses, 1 chronic and 1 acute illness. 30. General adaptation syndrome occurs in response to long-term exposure to stress. What are 3 stages of GAP? Primary, secondary, and final stage. Alarm, resistance, and exhaustion stage. Basic, fundamental, and temporary stage. First, second, and third stage. 31. The body has several types of physiologic defenses. What are some common signs and symptoms of physical stress? Dry mouth, rapid pulse, stammering, muscle tension, dizziness. Fever, cough, headache, sore throat. Eyes dilution, heartbeat, respiration, temperature. Tiredness, holistic, stressful, panic. 32. Nurse's job is very tiring and time-consuming. Select from the following nurses may have psychological effects due to stress. Lonely, not socially, talkative, communicative. Anxiety, irritability, depression, confusion, and forgetfulness. Shaky, muscle pull, staying busy, less diet. Sick, fever, CHD, OPD. 33. We all react or adapt to stress in our own way, but still we can feel ill. Choose the correct option from the following, which is related to stress-related diseases and disorders. Cancer, CHD, arthritis, pneumonia. Schizophrenia, depression, sickness. SB, dementia, Parkinson's disease. Headaches, gastritis, asthma, low back pain, etc. 34. We learn from the Maslow's theory that be punctual. People must satisfy lower-level needs before higher-level ones can be addressed. Hierarchy always work for a balanced life. We must follow biological rules of life. 35. The nurse explains that an idiopathic disease is one that develops suddenly related to new viruses, is caused by inherited characteristics, results from injury during labor or delivery, has an unknown cause. 36. The nurse assesses a terminal illness in a 43-year-old with Lou Gehrig's disease who is refusing food and fluid. A 76-year-old admitted to a nursing home with Alzheimer's disease who is pacing and asking to go home. A 52-year-old diagnosed with lung cancer who had part of one lung removed and has a closed chest drainage device in place. A 2-year-old child who burned her esophagus by drinking drain cleaner and who is being fed by a tube. 37. A patient has been advised by the primary care provider to take medication for high cholesterol and to change eating habits after discharge home. The home health nurse discovered that the patient refused to follow the medical and nutritional directions. The nurse's best initial response to this situation is to inform the primary care provider that the patient is unable to understand the instructions. Explain that without diet and medication the condition will worsen and serious problems will develop. Determine whether any cultural, socioeconomic, or religious values conflict, thus interfering with the patient's compliance. Emphasize to the patient how important it is to follow the doctor's advice. 38. The nurse believes that patient teaching of how to give insulin and monitor blood glucose levels will improve the level of the patients. Security, by providing psychological comfort. Self-esteem, by promoting independence and learning. Physiological well-being. Self-actualization, by seeking knowledge and truth. 39. Homeostasis can be described as a tendency of biological systems toward stability of the internal environment by continuously adjusting to survive. Biological wellness that comes from the ability of the body to change and respond to physical changes in the environment. The unchanging, steady condition of humans in a changing external environment. A response to stress that results from a person's choice of coping mechanisms to deal with the stress. 40. According to Hans Selye's General Adaptation Syndrome, GAS, a person who has experienced excessive and prolonged stress is likely to become resistant to biological methods of treatment, develop an illness or disease such as allergy, arthritis, or asthma, be admitted to the hospital during the alarm stage, seek treatment for imagined illnesses and non-existent symptoms. 41. The nurse instructs a patient that according to Selye's gas theory, when stress is strong enough and occurs over a long enough period, the patient will enter the stage of transition, convalescence, exhaustion, alarm. 42. When a young family man hospitalized after breaking his leg confides to the nurse that he is concerned about the well-being of his family and financial stress, the nurse can best support his sense of security by actively listening to his concerns, encouraging family to make frequent visits, distracting him from his concerns by socialization, reassuring him that his leg will heal quickly. 43. The nurse encourages a patient to participate in health maintenance by maintaining an ideal body weight as a method of primary prevention, simple prevention, secondary prevention, tertiary prevention. 44. When the brain perceives a situation as threatening, the sympathetic nervous system reacts by stimulating which of the following physiological functions? Select all that apply. Dilation of the bronchial tubes, decreased heart rate, constriction of the pupils, dilation of the pupils. 45. Which defines the holistic approach to caring for the sick and promoting wellness? Select all that apply. The nurse's focus is specific to the disease or injury. A change in one aspect of a person's life may or may not alter the person as a whole. Healthcare providers are required to intervene on behalf of all persons to ensure that health goals are met. The nurse realizes that each person has a responsibility for his or her own health. Providers combine traditional methods of healthcare with relaxation techniques for pain management. 46. The responses during the alarm stage of the General Adaptation Syndrome, as defined by Hans Selye, include: select all that apply. Decreased appetite. The body's adaptation abilities temporarily overreacting. Hormones released for mobilization for defense. Slight increase in body temperature. Substantial increase in energy. Covering Unit Number 2, Chapter Number 17. Infection Prevention and Control, Protective Mechanisms and Asepsis.